Welcome back to the Lars Larson Show. It's a pleasure to be with you, and I'm glad to take your phone calls and emails. There are a few people that we have heaped more scorn on lately than Andrew Cuomo, the governor of New York State. But now he pretends to have enough expertise to actually tell us all the important information we need to know about the China virus, and he's written a book. Dr. Kevin Pham joins me now from the Heritage Foundation. I wanted to talk to a real medical doctor about this. Dr. Pham, welcome back to the program. And does Cuomo actually know enough, and has he demonstrated enough by his crazy decisions during the China virus to actually get anybody to read his book and take it seriously?
Honestly, I think he probably knows quite a bit about how not to manage a pandemic in your state. Whether that qualifies him to write the book on leadership is an entirely different issue. He's seen firsthand how poorly his policies have affected New Yorkers' lives. So I would say he knows quite a bit about this, but it's not really an example that anyone should follow.
Yeah, and in fact, when I think about some of the decisions he made, for example, to say I'm going to transfer sick people with China virus from hospitals, which he had in abundance thanks to the federal government, that he, when he did that, he actually, I would say he killed people. He killed perhaps thousands of people by transferring them back to nursing homes in a way that did a tremendous amount of damage to people.
That is something that I still do not to this day understand. He recently had the gall to tweet out something about, I follow the science, not politics. Well, before this order that he wrote, that he signed, that required nursing homes to take back patients regardless of their COVID status, it was signed on March 25th. But several days before that, the CDC had released a morbidity and mortality report that showed that most of the mortality was in the elderly and particularly in nursing homes. And that CDC report came after 3 months or two to 3 months of us seeing that this highly infectious disease has had the most mortality on the elderly and in nursing homes, especially in Washington State. He should have saw this coming from a mile away at least. And we all knew from all around the world that this was exactly how it would turn out. And he still went through with this order, and it makes no sense to me. It's horrendous that it even happened.
So, and yet I haven't seen Cuomo come out and take credit or take the blame for having done this. In fact, he seems to be more interested in defending what he did to all these people than saying, you're right, I messed up, and this is the way not to handle it. He didn't do that.
Right, exactly. And I've been saying that, policymakers deserve a lot of grace and a lot of latitude for trying to make tough decisions in a fast-moving and highly uncertain time. But, they are also obligated to have at least an ounce of humility while facing these decisions that affect so many lives by so much. Not only has Cuomo not owned up to it, he's blamed other people for his mistakes, and then he's defended himself. And by the way, he's also blamed the nursing homes and the healthcare workers, not just the federal government, but he blamed the people who had to deal with his order, for having this disaster in his state. And at the end of all that, he has decided that it was an appropriate time to go and write the book on pandemic leadership and congratulate and pat himself on the back at the DNC. It's utterly galling.
Well, in fact, Dr. Pham, haven't we watched a bunch of government agencies and government actors make this kind of mistake? I mean, CDC early on said, no, you won't come up with a test to the private sector. They said, we'll come up with a test. And that was a screw up. And then their first test was a screw up. And then their second test had other problems. And yet these government agencies don't come out and do a mea culpa and say, okay, we understand what we did it wrong, and in the future we're going to do it differently. And they had good examples to follow. South Korea looked to their private sector and said, hey, come up with a test for us. We need it fast, and we need it to be accurate. And they did that, and it worked reasonably well.
Yeah, we're actually at the Heritage Foundation, we're working on something where we found out there was a guidance by the FDA that really hampered our early pandemic response. But you're absolutely right. There have been mistakes all over the government at multiple levels and across the entire country. There have been mistakes all over the place, and I am content with them just fixing the mistakes as much as they can and just moving on silently. Like, I don't need the mea culpas. I would like them. It would go a long way towards rebuilding the public trust. But what I just cannot accept is turning around and saying, no, this was great leadership. This was fantastic, and let me write the book on it.
No, but the only reason I like the mea culpas is simply because then it places blame where it should be, and that does allow you to move forward, because then you can say, well, it was done that way over there, and we know that was the wrong way to do it. Now we know the correct way to do it, and we can even identify. In fact, it becomes a lot easier to identify the mistakes if you can figure out where they were made and how they were made and the thinking that went into them, as opposed to saying, well, Cuomo says he did a fantastic job with this, but we don't think so. But he's telling everybody that he should be given credit for doing it right. Then down the line, 5-10 years from now, people look back and say, sounds like Cuomo did a very good job. At least by his account of it, he did a good job. That's not helpful to anybody, is it?
No, absolutely not. It's going to hamper any lessons learned moving forward out of this. And we already know that there were lessons from the last pandemic, the H1N1, that we didn't learn from. And so not only ignoring previous lessons, but actually taking as example some of the worst lessons, it's going to have a major effect on any future pandemics. And we do know pandemics are fairly periodic. They happen every couple of decades. It's a really bad one.
Well, and in fact, that's one of the things that I've always hoped that we could look at more closely. I mean, I've been singing the praises of Taiwan, not just because I was born there, but because I've looked at them and said, gosh, if they're 1/10 or a little smaller than 1/10 of the size of the United States, and we had similar numbers to them, I think they're still below 500 total cases, below a dozen deaths. Can you imagine if the United States only had 120 COVID deaths at this point, how successful we'd feel we had been?
Oh, yeah, we would be singing our own praises up to high heaven, as we tend to do on like 4th of July or something like that. That would have been a fantastic accomplishment. But, as we've seen, a lot of the hangups were bureaucratic in nature, and they hampered our response, and we really did lose the month of February when we could have been acting, but we couldn't.
And I know that this gets us a little bit into politics, but I guess that's why, Dr. Pham, I haven't trusted government for a long time. I think they're a necessary evil, and I think they should be used sparingly and in small doses, kind of like strong prescriptions. Don't use very much of it. Don't use any more than you absolutely have to be, because it's the bureaucracy of government that tends to fail, because when you fail in the private sector, you're a self-correcting problem. You fix you disappear. If you're a badly operating government agency, you tend to just go back to your legislative body and say we need more money.
Yeah, that's true too. Pandemic response is a core competency of the CDC, but having a core competency does not mean that you have done it competently. Whereas with all the private labs out there that were ready to go with their COVID tests right away, it's not just their core competency; it's also their business model. They live or die depending on their ability to run these tests. And what we're seeing is that they could have run these tests from the very beginning in large numbers. And if we were able to catch enough cases earlier on, then we may have been able to contain the disease a lot more before it got a foothold all around the country.
Dr. Pham, in the last 30 seconds, what do you think are the most important things this country ought to be doing going forward to try to make this fall as mild as we possibly can? Because I'm hearing some people suggest this fall may be very tough.
This fall is probably going to be tough because the COVID is still going to be around. Flu is going to start kicking back up. Probably the most important thing right now for us is to continue with just basic precautions. Hand washing especially. Try to stay in if you're sick, and just be a lot more open to flu vaccinations. They're not always very precise at predicting this particular strain, but getting vaccinated for the flu is going to do a lot to help the overall health situation in America.
I think that's a great prescription. Dr. Kevin Pham, who's a visiting policy analyst at the Heritage Foundation. We'll be back in a moment. I'll get to your calls at 866-HEY-LARS. That's 866-439-5277. Emails go to talk@larslarson.com.